The desk.
The clerk will designate the amendment.
Amendment number 38, printed in House Report number 118-158, offered by Mr. Roy of Texas.
Pursuant to House Resolution 614, the gentleman from Texas, Mr. Roy, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from Texas.
I thank the chair. This amendment that I'm offering prohibits any of the funding in the Milcom VA appropriations bill from being used to carry out what I believe are unnecessary and unscientific COVID-19 vaccine mandates at the Department of Veteran Affairs. Now, there's been some confusion about this. Some people have said, oh, well, that's not really still going on. Well, I just got an email today from the VA saying, yes, it is. There still are vaccine mandates that are being carried out at the VA. And to the best of my knowledge, it is the last remaining federal vaccine mandate, and it needs to end. Most federal vaccine mandates ended in May of 2023 with the end of the public health emergency. The VA was one of the few agencies to leave the mandate in place. VHA Directive 1193.01, COVID-19 vaccination program for VHA healthcare personnel, outlines the policy and guidance for mandatory COVID-19 vaccination for Veterans Health Administration healthcare personnel is still in effect. The mandate applies to EMS personnel, nurses, nursing assistants, physicians, technicians, therapists, phlebotomists, pharmacists, health profession trainees, clerical, dietary, environmental services, laundry, security, maintenance, engineering and facilities management, administrative, billing, and even volunteers. If you want to volunteer at the VA, you better get a jab. The COVID vax mandate is unnecessary. It hurts healthcare workers. I believe it hurts healthcare being provided to our veterans. As of July 15th, 2022, the VA had disciplined some 74 workers that we know of, some of whom were fired. I do not believe the mandate is necessary to keep our veterans or the VA staff safe. The former CDC director has said that the vaccines can't do anything to prevent transmission. This amendment is about ending COVID madness once and for all at the VA and making sure that anyone who wants to provide medical care to our great veterans can do so, and I reserve.
The gentleman from Texas reserves. For what purpose does the gentlelady from Florida seek recognition?
Madam Chair, I rise to claim time in opposition to the gentleman's amendment.
The gentlewoman is recognized.
Thank you, Madam Chair. Madam Chair, I can't really believe I have to say this out loud, but vaccines have been essential in reducing the severity of COVID. I would note that VA's vaccine requirement currently applies specifically to healthcare personnel, who are the people most in danger of not only contracting but spreading this disease, especially to the vulnerable patients that VA serves, many of whom are at high risk for the long-term effects of COVID. Additionally, at its highest point during this pandemic, VA had over 15,000 staff unable to work due to either infection or exposure, with over 9,000 of those clinical staff. That has a significant impact on patient care, and I think we should all agree that no veteran should be turned away from care because there wasn't a provider available to treat them. VA took extremely reasonable steps to protect its patients and its workforce, and we shouldn't be tying VA's hands when it comes to managing their workforce and pursuing workplace safety and protecting its patients. So it was a responsible decision to limit the vaccine requirement to care providers in clinical settings, and this amendment, if it passes, will ensure that more VA employees get sick, more of their patients will get sick, and there's a certainty that more people will die if we don't ensure that VA employees who treat patients are vaccinated. That is just common sense and should be understood based on the experience of the time we all spent battling the pandemic. So I urge my colleagues to oppose the amendment, and I reserve the balance of my time.
The gentlewoman reserves her time. The gentleman from Texas is recognized.
I would only respond to the gentlelady from Florida when she said it only applies to healthcare personnel. I just rattled off an entire list of virtually every known possible human being and job that could apply at the VA, and a whole lot of them aren't, in fact, healthcare personnel. I went through an entire list, including laundry, security, maintenance, engineering and facilities management, administrative, billing, even volunteers. Some of my colleagues have said, oh, this doesn't apply to the VA. Like I said, we reached out to the VA, and sure enough, they replied today, yes, the vaccine mandate still applies. Nevertheless, we get rid of the Medicaid, and we get rid of the Medicare mandates. Private sector's out there. I mean, they can do what they want to do, but the vaccine mandate has come and gone in terms of something that the American people believe we should tolerate. They want to be able to move about without having the fear of losing their job, and we've got people at the VA losing their job. We've got nurses that have given up their ability to practice. We've got it throughout our entire industry. We've got members of our military that have been held up from being able to be promoted and be able to advance. We've got people at the VA. I've met with people who worked at the VA, some of whom who were facing losing their job. This should end. This madness should end. And that's what this amendment would do. It would ensure that no funding goes to continuing and perpetuating that mandate. And with that, I would yield back the balance of my time.
The gentleman yields back. The gentlewoman from Florida is recognized.
Madam Chair, I'm prepared to close at the appropriate time.
The gentlewoman has the only time remaining.
So the gentleman won't be speaking again?
The gentleman yielded back.
Okay, thank you very much, Madam Chair. I think it's important to point out that it is not just healthcare providers that work in VA healthcare facilities. Maintenance workers work in VA healthcare facilities and interact with patients, and they move back and forth throughout the facility. Cafeteria workers, other people who are not healthcare professionals work in VA facilities in and around the most sensitive patients being provided with care in the most intense healthcare environments. They can infect people with COVID. They can infect healthcare providers who work at the VA, who interact with patients even more closely, and they can infect patients directly. It is a responsible policy to ensure that where there is a severely ill patient or someone who is extremely vulnerable and has their immunity lowered, as a breast cancer survivor, I can tell you that when you go through chemotherapy, which I did not, but I have obviously spent a lot of time on understanding what breast cancer patients and people who go through chemotherapy experience, your immunity is knocked out. So we're going to prohibit people who work in VA healthcare facilities from wearing masks to ensure that someone who's had their immunity system knocked out from being protected from an individual who might have COVID while they're at work. That is grossly irresponsible, and it would result potentially in people getting sick and dying from something other than what they're being treated for at the VA. That is the height of irresponsibility, and I can't believe that our friends on the other side of the aisle would be willing to risk the life and health of VA patients with this irresponsible policy. We have to make sure that in a healthcare setting, that people who interact with patients in any way are protecting the patients from getting sick. And that's why this amendment should be defeated. I yield back the balance of my time.
The